Hi, welcome to Happy Home Diaries. We are happy and talking about post-Caesarian section care. So whether it is planned or unplanned, it is a Caesarian section and it is good and it is going to heal, and that is after we take good care of ourselves. And so we are considering that there is a mother and a baby, and you need to heal and to heal very well and also breastfeed at the same time. It is a time that you need to take care of yourself so that things go well and smooth. And so how do you take care for yourself after the Caesarian section? One, it's about bathing. Bathing is very important. Just shower. You can shower on a normal shower, but not on a bathtub, because showering will help you to get clean, and it is good. So after showering, what you do, you wipe yourself at the incision site with a very clean towel, a very clean clothes, and so that the wound site is left dry. After that, you will check. Ensure you check or you tell somebody to help you look at the wound. It should not have any open area, so it should be as sealed as possible. And also be checking for any discharge. Check for any redness or anything that would show a sign of infection. If you find any of these signs, please report to your doctor, and so that this thing is corrected. The next thing is about medications. The medications that you are given for Caesarian section are very important. Ensure you take them and take them compliantly. Mostly it could be an antibiotic and also maybe a painkiller. Just take them compliantly and it will be well. Next, we look about exercise. So you need to walk along the house. Just walk along. You can't do very serious exercises at the beginning, because the first days are meant to heal. So don't do very severe exercise, but ensure you walk around. Keep walking around. When you wake up, just walk. Don't just lie in bed the whole day. You need to walk around to ensure the body is active, and this prevents embolism, risk for embolism, and risk for maybe failure to heal fast. And this one helps a lot. So do some walking around and it is good. As you walk, avoid also lifting very heavy materials. Lifting heavy things and also doing some laundry, bending a lot, just let somebody help you at that time. Remember to look for help, seek for help, and it is very important. It is not bad, because help is important to make you rest, because if you work and do a lot of working, it brings a risk for you to heal with some issues and some pains that don't go away. If you have pain at the incision site, what do? You can tell your doctor, because if you don't have painkillers, that your doctor can prescribe some painkillers, because you should not have pain bothering you a lot. If there is very severe abdominal pain, there is a danger sign, and so if it is severe, ensure you seek help from your doctor. It is very important. Don't attempt to remove the stitches that have been put on you. Mostly the stitches that are used could be absorbable, and so they just go off on their own. But if your doctor had put staples or non-absorbable stitches, they will ask you to go back to hospital after some time, and that is when these stitches will be removed. Next, we want to talk about breastfeeding. So ensure you breastfeed sufficiently. Hopefully you have enough milk and the baby is getting satisfied. We want this baby to get satisfied because we are avoiding dehydration. So you can have a breastfeeding pillow that is good and helps you to breastfeed and place your baby well. And so a pillow that will help you to lift your baby to a good position, and breastfeeding will be perfect and well without you getting tired and the baby getting insufficient milk or sucking in air. So do sufficient breastfeeding and take naps when the baby sleeps. This is very important, to take naps, and this help you to be psychologically stable. If you notice any depression, signs of depression, you feel like harming yourself or your baby, it is a sign that you're psychologically unstable, and this one could lead to need to see your doctor, and so that you're treated and also advised, and it is important to be treated so that you move on well. Pads you use, you should not use tampons. Use pads, normal pads, because we need your vaginal walls to heal very well, because for some you could have attempted labor and already there are some injuries inside your birth canal. So just ensure that you just use normal pads so that healing moves on very well. Avoid using detergents that for bathing. You don't need them at this time. As from 6 weeks, your doctor will advise you as to whether it is safe to use detergents to wash your body or to wash yourself. Next, if you have maybe lacerations, or you had lacerations at your vaginal wall or at your perineum, you need to do some sit baths with maybe an antiseptic or salt. Salt sit baths are very effective and very good. You don't put a lot of salt, you just put salt to taste, and you do some sit baths. Those are very important to aid in fast healing. Next, we will talk about rehydration and diet. You need to use a very good diet for yourself. You need to take iron, take a lot of iron and supplements that you could have been given, maybe vitamin C and vitamin A. Vitamin C, you could get it from fruits, oranges. They are very important. Vitamin A also aids in healing a lot, so you get it from all vegetables, a lot of vegetables and carrots. So it is important to take a very balanced diet. Also, you need some protein that could come from meat, from cereals. You need proteins in your food, and so that healing becomes very fast. Rehydrate yourself a lot. Continue taking a lot of water, especially during the day. It is important to take a lot of water. Remember not to have sex after delivery. This one could cause infections and also injuries to your wound, and so remember to avoid it. And it is important to avoid, because until your doctor tells you that it is safe for you and has planned, it becomes planned for. So it is important to take care of self. Observe yourself for any danger signs. If you're feeling you're vomiting, maybe you're fainting, if you have a lot of bleeding, blood clots that go up to 4 days, it is important to visit your doctor. Maybe if you have any fevers or any psychological feeling of harming self or harming the baby. Also, if you have any issues that bother you a lot, it is good to visit the doctor, and so that it becomes treated. Even if the discharge also becomes smelly, it is a sign of infection, or if your lymph nodes start swelling, it is also a sign that you could be having issues. But all in all, I wish you a very good and quick recovery. Breastfeed well, bond with the baby very well. It is a good time to recover and have a good time. Hope you enjoyed the video, and subscribe and continue subscribing and watching more. And God bless you so much. Thank you.